Hi everyone. It looks like we are live. How is everybody doing here? It's just so great to see you guys all, and I know some people are just trickling in, so I'm very, very happy to be here with you guys. It's starting to get a little fall-ish or winterish over here, so hence the heavier coating. So hi, Padia. I don't know if I'm saying your name right, but hello, it's nice to see you. So if you want to just say hi and tell me a little bit where you're from and such, that would be awesome. I'd love that. In the first comment of my of this video live, you will be able to find some sign in, some login, and some information and links to my book and video series, and also my website. Oh, hi, Paisha. Hi, Paisha. Oh, okay. I got it. Hi, Paisha. Thank you. I'm sure you get that all the time. Hi, Carol. Nice to see you here. Marilyn from Rainy, Iowa. Yeah, I think we're going to get some of that ourselves as well for the next few days, it seems like. Ohio. Hi, Melissa and Grit. Good to see you guys. Good. I got it, huh? iPad, yeah. All right, very good. So, for those of you who don't know me, I'm Dr. Odette Suter. I'm a holistic veterinarian, and I'm in the Chicago area at the moment. And what I focus on is really proactive care, educating people. That's one of my big passions. So I want to talk to you a little bit today about, what's been going on in the world of the veterinary care and, healthcare for animals, and kind of broaden it a little bit as well. But again, for those who are just joining from Florida and also Chicago area and other places, hello. It's so good to see you. In the first comment, you'll be able to find some information on how to subscribe to my newsletter, my website, link to my book, and then also, my video series. So anyways, today I want to talk to you about, what's going on, but I also want to keep the floor open for you guys to let me know what's going on and, in your world, and what challenges that you've had with your animals and with veterinary care and such, because I know it's been a bit challenging for everybody, and I want to know what's going on for you guys and what you're looking for, and what's been challenging and what has worked as well, because that way we can all sort of help each other and have a bit of a community thing going on, because it's been difficult being so disconnected from things, and sorry, I'm trying to post this cross post it, because I know other people wanted to get to it, but I'm having a little bit of a challenge here. Sorry. And I lost my train of thought, obviously, in the process. Okay, I think I got it. Okay, I'll be right with you guys. 1 second. All right, there we are. 1 and 2. There we go. Okay. I wish it could be done ahead of time so that I don't have to spend time to cross post once I'm live. But I guess, Facebook, if you guys are listening, that would be nice. Anyway, so I want to keep this open so that you guys can share. So please put in the comments, what your challenges have been and what you would like to be different, and just share what's been going on for you guys. I would really love that. So I want to try to kind of start, and talk a little bit from the veterinary perspective, and also from my own journey recently. because it has been quite challenging for veterinarians. Oh, hey, Gregory. It's been very challenging, and maybe Gregory, you can chime in as well because you work as a veterinary nurse. So you've been, on the front lines of, the challenges that we're all facing. And one of the biggest issues that we have in the veterinary world is that we just don't have enough staff. Where, there's a huge shortage, and everybody is a bit burned out. And so that makes it really difficult because on one hand, there's not enough, veterinarians to take care of the animals, and there are also a lot more animals that need taking care of. And that's in part because a lot of people have gotten new pets during this, pandemic, and received, and needing more care, because of that. So there's definitely been an increase in that regard. But the other issue that I also see is that because we have a lot more stress going on this planet in general, um, and things are up for everybody. Nobody is being spared. Everybody has to change. Everybody has to reevaluate their lives, and go with the new, I won't call it normal, but the changes that are happening. And so because of that stress, I feel that a lot of it may also be happening, being transmitted to the animals because they have a lot of, they pick up on our stress. And as a result, I feel that a lot of animals are much more sick than they used to be. It's harder to treat. It's harder to get them to change and become healthier just because they're also sitting in that stew of, adrenaline and stress hormones that we're all sitting in. And again, that's no judgment of anything or anybody. It's what needs to happen. I think it was it was time that some change happened on a big scale. So it's a good thing, but it comes with a lot of issues. And I know the veterinary world is not the only work environment where we are lacking people and workforce. I know it's across the board, in the human field as well. Um, but anyways, that's a huge issue, and so we're all suffering from a bit of burnout. And from my own perspective, a couple of months ago, I just hit a wall. I just couldn't continue working the way I was working. I was tired. I basically didn't care anymore. And I just felt like there's something needed to change. I just like, no more. I can't do this anymore. And I know that a lot of veterinarians and veterinary nurses and doctors and a lot of people are feeling that way because we're all, going through a lot. So, um, that obviously brings a lot of challenges because not enough workforce, too many animals to see. Where does that leave you? And so I want to talk to you a little bit about how you can work with things within the veterinary world itself, but then also I want to shift to finding a bit more of a solution, and working towards that because we can't really fix the problem from within the problem. Or, like Einstein said, that if we repeat the same thing over and over again and expect a different outcome, obviously that doesn't work. And so we need to be smart and we need to kind of change things so that we can really turn things around for all of us. And we're all in the same boat. You know, what I do hear a lot is that, clients are being rude, and front desk people are being yelled at, and things like that. Thankfully, I haven't experienced a lot of that. And again, there is no judgment. There's absolutely no judgment today that I'm making here because I can also understand that when people are stressed out about their animals, they're like in a panic mode. And then when we are in a panic mode, we don't respond in a very, sometimes not in the most kindest way possible. We all have our ways to um, yeah, respond to stress. So it's not meant to be as any kind of judgment. I'm just talking about more what's just happening as a reality. So with that, stress that we as veterinarians and vet techs and front desk office people are exposed to, that makes it more difficult. And that certainly increases, the potential of burnout and um, yeah, and people leaving the field. We've had a lot of veterinarians that have left the field. We have a lot of vet techs that are looking for a different job because it's just not doable. It's just too hard. Because frankly, we used to use horses and bulls to do all the plowing and the heavy lifting and the work, and we basically worked them to death back then. But right now, it's more like we humans are working ourselves to death, especially in the U.S. I'm not sure about other countries, but I'm certain we're not the only ones. But there's a lot of that going on. So we have to kind of support each other. So basically, what I was getting to is that we are in this together, and we have to work with each other and help support each other. And I think kindness goes a long way, um, because yeah, it's usually the negative things that tend to stick more. And I can speak from my own experience. In the a couple of weeks ago, I was working with someone who was already yelling at me before I even met her, basically. So that kind of really stuck, and you end up ruminating, and keeps you up at night, and it's just those things that tend to stick more, than the things that are working well. Although recently those stick well as well. And so I want to just chat with you a little bit about what to do to kind of make it easier when you need healthcare for your animals. So for one, don't wait. If there is an issue, make sure you get an appointment, you get in with, you get on the schedule right away, especially if you need to get um, again, Lisa, I just saw your comment. Oh my God, yelling at you. Again, it's not a judgment of anybody, because when I get stressed out, I also don't always respond in the way that I should. So, we're human. This is not about being perfect or anything. We're human, and we can always apologize afterwards. We're human. That's the bottom line. But anyway, so going back to, if you need a specialty appointment, if you need a dental cleaning, you need an echo for to get your animal's heart checked out, or you need a consult with a neurologist, or whatever it may be, don't wait until it's high time. Schedule ahead of time. All the things that you can schedule ahead of time, get on the schedule, because a lot of these specialty services take a while to get into, some of them up to 2-3 months. Um, so you want to make sure you get on those right away. And especially if you want to do dentals as well, make sure you get on the schedule for a dental. And then when then go in for the exam and the blood work that needs to be done prior to anesthesia. So basically, don't wait. That would be kind of the biggest recommendations. Also, make sure that if you do work with a holistic vet that does not offer all the services that you could possibly need, obviously we have emergency services or emergency hospitals that specialize in that. But if you work with a veterinarian who doesn't have everything that a regular practice would have, as far as diagnostics go, such as, basic surgeries of mass removals, radiology, taking X-rays, um, ultrasound, things like that. If they don't, if like, because for example, myself, I don't have all of that available. So I need people to still have a regular veterinarian that they can get into. So it's very important that you still have a regular vet that you have a good relationship with, that you can get in if you need it. So that's really important, because most of us are very full as far as our schedules are concerned. It may take 2-3 weeks to even be able to get in, on short notice. That's the short notice these days. So you want to make sure that you do have some, a good support system, so that you have choices that you can go to. So make sure that you do, check out different veterinarians in your area, check with different friends of yours in the area as well, to see who does what, and who they like, and that sort of thing. Make sure you get your annual health exams or semi-annual health exams, depending on the age of your animal, blood work, and make sure that all the routine stuff is being done on a regular basis, so that it doesn't become an emergency. All of a sudden, there's something wrong that may also already have been present a while ago that you may not have noticed. So make sure you, yeah, be proactive. And if you work with a veterinarian or a clinic where they won't let you come in, where they still are doing curbside, um, make sure that you write a letter, or like a note that you send in with your dog of the things that you do want to have done and the things you do not want to have done, and make sure that that note really gets to your vet. You can also send an email ahead of time. If you have an animal where you're really worried about vaccines and things like that, you can put a shirt on them and write on the shirt "no vaccine," so that the dog is going in with the shirt, so everybody will see it. Because I know that's been a concern for a lot of people, that the animals are not getting, that they may get something that you as the guardian didn't want happen. Make sure you let them know that you will not approve anything before somebody talks to you. So you want to make sure that you approve everything, because that will also help for things not to just happen. And again, that's not judgment of other veterinarians and such, just because they're overwhelmed, and everybody's overwhelmed. And when we're overwhelmed, we kind of go into like a automatic pilot oftentimes. And so what can happen as a result of it is that maybe an animal might get something that they shouldn't have, or you didn't want happen. So make sure that you communicate that with whomever is taking your animal in, that you want to make sure that that doesn't happen. And again, that's not a judgment, it's just overwhelm, lack of enough people, and that can also cause communication, I wouldn't call it breakdown, but where one just doesn't communicate with the other. So you want to make sure that everybody knows what's going on with your animal, and what you want done and what you don't want done. So that would be very important. And then I made myself a list here. Then there are things that you can do at home to prevent things, because there are a lot of things that can be prevented. So make sure that, if you have a dog that counter surfs or goes into the garbage can, or, finds food in any way possible, make sure you just put everything away. Don't leave it out. Especially during the holidays, make sure that you're prepared for the holidays, that you're also prepared when guests come. And I do have a Facebook Live on that subject. It's in the videos on my Facebook page. So you can certainly watch that, with lots of tips and tricks for that. So you want to be really proactive and prevent a lot of things that way. And then yeah, educate yourself, and be patient. And I will get to the education part a little bit more, but be patient. Be patient not only with the people that you're in contact with, but also with yourself, because I feel when people come to see me with their animals, I feel that their stress level is really, really high. And for a lot of them, I had to start to just have them sit down, and we're just closing our eyes and taking some deep breaths for a while, just to bring that whole anxiety level down, because sometimes they start talking to me before we even get into the room. The scale is outside, so we put them on the scale and they already start talking to me about everything, and I'm like, let's just take a breath, let's just get in the room, because the first thing I'm going to do is to give your animal a treat, if they can have it, because that also helps to bring down the stress level for the animal, because it stimulates the parasympathetic nervous system, which is the relaxation part of the autonomic nervous system. The other part would be sympathetic, which is the stress response. And healing can only happen when we're more in a relaxed and um, state where we can accept the healing, and that goes for the animals as well. So I want to create a space where the animal can actually receive that healing, but that can only happen if you, as pet owners can also help try to breathe and be a little bit more at peace, which I know is very difficult, especially when a lot is going on. But that's something that you can also practice at home, on a daily basis, to just breathe with your animals, to connect with your animals and meditate or whatever it is that brings you peace. Go for walks with I don't know, paint or, you know, crochet or whatever it is that you do that helps to bring you peace, because it's very important that we practice that. um, and peace and meditation, well, meditation, we call it a meditation practice, so it is a practice, it's a skill, and that's a skill that's very important to have in life in general. And when you bring that peace in with your animals, everything can be easier as well, because from a more energetic perspective, I have found it much more challenging to actually see the animals. And by seeing, I'm not seeing, meaning visually seeing. I can see them, but it's people are so stressed these days, and everybody's shit is up, basically, including mine. Um, so with all of that, we kind of bring that with, and so people bring that with, and so in the end, I'm becoming a bit more of like a not a psychotherapist, but where I have to deal with the people's emotions a whole lot more than I used to, which then takes away from me being able to also connect with the animal more. So it makes it easier if you can be more at peace and more, relaxed, because then I can actually help your animals a little bit more as well. But again, no judgment. We are how we are, and we have what we have. And the reason I studied psychology at some point was so that I would be able to help you as well, in the process, because dogs, they are, or animals in general, they are an extension of our hearts. They you know we just love them. So when something is going wrong with them, it's like our heart is being torn out of our chest and in different pieces. So they are our catalysts, for change, basically, because a lot of people start changing when something is going on with their animals, and something isn't going right. All of a sudden they're open to learning a lot of things. So they are definitely our helpers in many, many ways on this planet, to help us grow and um, yeah, help us grow. So it's really important to, yeah, bring your stuff, but also meditate at home and work on it. Because I do too. I have to work on stuff too. I meditate, although I hate it because I'm not very good at it. But it's just what we need. So breathing, certainly, even if you get to the veterinary appointment, you have to wait a little bit. Just breathe. Put away your cell phones, turn them off, and just breathe with your animals while you wait for someone to come in and see you. I think that would be very, very helpful. All right, so breathing. Yeah. Oh, yeah. One more thing about stress, because when we're stressed, we also, not just I myself having a harder time connecting with the animals, but if you're stressed out a lot about something, take a breath first, because then all of a sudden you may actually connect in with your own intuition and know what you need to do for your animals. Because when we're in a stressed mode, it's like the brain doesn't, we can't think clearly enough, to really tune in to that gut feeling and to, know what to do. So certainly, very important when you are in a stressful situation. Just remind yourself to breathe deeply into the, you know, right below the belly button, and just breathe in and out a few times, because that will help you to reconnect with things. All right, and then what else did I have it? Oh yes, when you do send emails or phone messages and things like that, keep them short and sweet with the most important things in them. Long emails are like, I have to admit, it is a turnoff. I, uh, it's like I see a long email, I'm like, oh my God. So keep it brief, even if it's just bullet points, that works as well. And phone messages as well. get your phone number out, what you're calling about, and we will call you back as soon as possible. Long messages with the phone number at the very end, spoken very quickly, that is very challenging because then we have to re-listen to the message over and over again to finally get the phone number. So make sure you are very concise, make it simple, no long stories. The stories, for at least with my practice, what I do is I send out a questionnaire for people to fill out, and that's where all the information then goes because I wouldn't be able to remember it anyway. So keep it short and sweet. And then, when you talk to your vet and the vet tech also, if they ask you a question, keep the answer brief. Tell them what they asked about and don't go into a lot of different tangents on things too much, although a lot of information is important. So I don't want you to feel like you're getting cut off either, because a lot of times information kind of comes about with what you're saying, in other ways. But definitely kind of keeping things a little bit more concise would be very helpful um, on our end. And then what I've also seen recently is that, with the whole curbside, that people drop off their animals and then they go do some errands. And then at some point they come back. They talk on the phone with other people. They don't pick up the phone when we call them to let them know what's going on. So that's not really too ideal. It's not very helpful for us in the field because we don't want to keep your animals longer than we need to, because if we do, we have to put them in a cage while we continue what else we're doing, and your animals don't particularly appreciate that generally. So make sure you just stay in the parking lot and wait, and keep your phone on so that when we need to talk to you, that you can pick up the phone. And just wait there. Obviously, if your dog is getting a dental, that's a different story, obviously. But if it's an appointment, just stay and don't leave. It's much easier that way. And then if you do go to a regular vet because something is going on, please don't expect them to be holistic vets, because that's not what they do. That's not what they offer. That's not what they're good at. Because we each have our niche and we each have the things that we're good at. And so if you go to a traditional vet, then you will get traditional treatments and traditional recommendations. If there's something that you don't like about the recommendations or you don't want them to do, then just say no. I would really rather not. There's no point in getting into an argument with anybody. Just state the facts, like if they want to vaccinate your dog and you don't want to do that at this point, just say, I think I'm going to wait on that, but thank you so much. So just remain kind that way, because, arguing that doesn't usually, you know, get us very far. So stand your ground, and then uh, let's see. Yeah, so I think those are sort of some of the tips and tricks of things, especially, oh yeah, one more thing. If you do uh, go to an emergency vet hospital and you end up having to wait in the parking lot for a while because your animal is not first in line for the emergency, because it's not, totally emergent, life or death situation, you might just consider stopping by the next nearest, bakery or Starbucks or one of these places and bring them some goodies, because the emergency vets have actually taken the brunt of things. And I want to give them a big shout out, not the vets, just the vets, everybody in the emergency departments. They are working, tirelessly, and they are definitely getting probably some of the most, significant abuse from people, just because, again, there's so much stress that comes along with animals not feeling well. Again, no judgment there. So if you're in the space and have a little bit of finances, just bring them something good, make them feel good, send them a little note afterwards or something, because it makes a huge difference. And I can tell you that because, every time I call the emergency department somewhere where I have to refer them, I always say them thank you, and they're always so grateful. It's like, oh, thank you so much for saying that. And it's really not a big thing, just to send them a little bit of gratitude that way. So for all of you guys who are already doing that, thank you so much. And I know most people who are here listening are already, some of the kindest and most, educated people, and we appreciate that. So please keep sharing that with others. Share this video with others as well, and other things that you find online and such. Just share with people, because we all need that, and we all need the support that way. And that kind of brings me to the next part of it, and I will get to the messages here. I know you guys have been leaving a lot of messages, so I will get to those. So the next part is really about, how do we actually fix the problem? How do we get through this in a better way? And as I mentioned earlier, we can't really fix the problem from within the problem, because nobody can work harder than they already are. It's just, impossible. I certainly can't. In fact, I've had to take a lot of time off just to rest, to kind of rejuvenate my body and my soul as well, because when we're in a constant um, you know mode of overworking, our soul doesn't get any rest either, and our hearts and our emotions, and it kind of stifles things, including creativity and other sorts of ideas and joy and all of that. And so for me, when I hit the wall, what I realized is I wanted to teach more. I wanted to be more creative. I needed to connect with all of you guys again. Last year, still, I was able to, be part of a lot of holistic Facebook groups and contribute to those. And it just became so much that I just couldn't even do that anymore. And I do want to be available to a broader audience and more people, and share the knowledge that I've accumulated over the years, or decades, I should say. um, so I want to share that more, rather than just be only in the trenches and kind of take care of that, because in the trenches, even as a holistic vet, it was becoming a bit more of an emergency type of service that I was providing, where it it was emergencies just dealt with in a more holistic sort of way. And that's not really what I'm about. I'm about educating people. I'm about being proactive. I'm about preventing things. I'm about creating longevity and that sort of thing. So um, it's quite opportune, obviously, that somebody came out with a really amazing book recently. Um, The Forever Dog by Dr. Karen Becker and Rodney Habib. They just came out with this book. I highly recommend that everybody purchase that and give it as gifts to your family members, even if they don't have any animals, because this book is not just about animals. Everything in here applies to humans just as much. So it's a great book for everybody, whether you have a cat or a horse or whatever it may be. Get this book. It's very important that we share that information and pass it along. And then obviously I have my own too, my little bestseller, which is a little smaller version, not as much science. People tell me they can get through it in a couple of hours. Big print, some pictures in it as well. So that kind of gives you the basics. Sorry. Anyway, so that one is also available on Amazon. The Forever Dog book is also available on Amazon and different retailers as well, and also in different pet stores are carrying it, especially the more holistically oriented pet stores. Feel free to also gift that to your veterinarians, because especially the Forever Dog has a lot of science in it as well. So definitely pass on these books. Those are really important, because they really give you the blueprint of what you can do at home already, to then have to not go to the vet as often. I mean, I still do recommend yearly checkups and blood work and, semi-annual, once they get a little bit older. Certainly, it's books are not a replacement for veterinary care and having somebody look at them, but it can certainly make it a lot easier, and create a lot less emergencies that way. I also have a video series that is very in depth, where I go into all the different subjects of the 6 pillars of health, that are, diet, GI health, detox, hormones, the nervous system, and fitness and exercise. So I get into a lot more depth on those, including also vaccines, heartworm prevention, and heartworm in general. So highly recommend it. So that really, what I'm really trying to say here is, you need to be educated. You need to get educated. If you aren't already, you need to dive in, because that's the way that we can really make a difference. And this diving in will not only help your animals, it will help you as well, because the more you can help your animals be healthy, the more you can also apply this to yourselves and to your families, to your own health, and on the broader spectrum also to our planet Earth, because we are in the process of destruction. We're going down a road where we're pretty much heading towards the end of existence if we don't change, and that's part of this whole you know pandemic, is to get us to change and make yeah, wake up, because this was a big wake up call for everybody, that we can't just float around and not care about anything. We know we have to do something. So it's really important that we take care of everything and do better, because nowadays, with the toxic exposure that we have, with the emotional toxicity that's going on, with the things that are coming up, we don't have the luxury anymore to do things less than perfectly. And I hate using the word perfect, but you cannot feed a dog kibble and expect them to be healthy and to have a good foundation. It just doesn't work. And I know there are exceptions to each rule, but there are certain things that we just absolutely cannot do, because the body can't handle it. Maybe 50 years ago or so, when the pollution wasn't as bad and people were more laid back and, not as stressed, it was a possibility to do things like that. But nowadays, we just don't have that luxury anymore, and we do have to do better. And one big part of it is exercise. A lot of people are talking about diet and a lot of good things, vaccines and such, for our animals, but exercise is one of the most underappreciated health things that you can do for your animals. They have to have exercise, and you as well. If I can share one regret that I have in my life, is that I didn't exercise enough. I just, for like 20 years or so, I didn't exercise. I was just I was moving through the day. It's not like I was just sitting on the couch all day, but I didn't really exercise. I didn't take care of my body in that regard. And exercise is important, because with exercise, your animals will have more muscle mass. They will have more blood flow through the entire system, which will help bring more oxygen, which the cells do kind of like that. They like oxygen to be able to function. It also keeps stimulating the brain, because a body that moves gets constant input from the brain gets constant input from the movement, and then that keeps the neurons alive, and it also obviously brings blood flow to the brain, because a lot of times when the animals have inflammation in the body, their brain is inflamed as well. So with increasing the blood flow to the brain, that can also help to decrease the level of inflammation and help to clean it up. Because as they get older, we often see that they end up with some issues, with dementia, and some cognitive issues, and then also some weakness in the limbs. So it's very important that we make sure that they move a lot, but it has to be good exercise. But I don't want to go into too much depth on that, because I also want to check on your things. But anyways, I did promise in my newsletter that I was going to share a little bit of some exciting things. Um, So for one, I'm cutting back a little bit on actually seeing patients, although in my own practice that's going to stay the same. For those who know, I work at another practice as well. I'm cutting back there so that I have a bit more time to, be more globally available. So what I'm planning on doing in January, I'm going to start to offer a course. It's going to be a bit of an intensive course of about 8 to 10 weeks. I haven't quite figured out the length of it, where I will be going into the depth of all the things that are necessary for an animal to be healthy. There will also be some Q&As. So every week we'll do things together and chat. And so that's going to be coming up sometime in January. So watch out for the announcement. It's going to be definitely in depth. The video series that I already have um, is going to be kind of the foundation of that as well. And because I also want to get my video series approved for RACE, which is the Veterinary CE. It is veterinary level, but obviously so that everybody can understand it. I don't use a ton of heavy duty words, or if I do, then I explain them. So anyway, so it's going to be a very in-depth kind of course that I'm going to be offering starting sometime in January. And then for next year, I'm also going to be hosting a dog detox summit with the Pet Summits people. And for those of you who already were listening to the Gut Summit that Dr. Katie Woodley was hosting a few weeks ago. So it's with the same people. So there are going to be different veterinarians. I'm going to be interviewing some of them, and then also some of them will just do presentations. So stay tuned for those. There are going to be other pet summits. Also, in the meantime, mine is going to be in May, I believe. But Dr. D. Blanco is also doing a dog summit, a holistic dog summit with pet summits. Hers is, I believe, in March. I can't remember. But anyways, there are going to be some good pet summits there. So you can check it out. Let me just see if I can pull up the yeah, so it's petsummits.com. I'm going to post the link so that you can check it out. Definitely highly recommend it, because that way you also get information from a lot of different people, different veterinarians, which is good because we all work differently. We all have a different message. We all have different things that we focus a lot on. And that we're better at. So very important to kind of support all of these people. Dr. Becker obviously does a lot of stuff with Rodney Habib as well. And then there's Judy Morgan, there's Will Falconer, there's Katie Woodley. She's also doing a course that she's starting soon or already started. So there are a lot of veterinarians, holistic veterinarians, that are shifting more into educating. So please take advantage of that, because that's really the way to go. I know it's a bit of an investment, but it's going to be well worth it. And I don't remember if I already talked about, no, I don't think I talked about insurance. That's also something I do recommend more and more these days, is that you get health insurance for your animals. What I usually say to people, either, put away money every month, so that you have something, that you're building up on, and have some resources if something were to happen. Or if you don't have $10,000 to $20,000 laying around, just get some health insurance, because healthcare can get pretty expensive pretty quickly. So you want to make sure that you're, prepared that way. So whatever works with your with your budget and your lifestyle, and what you decide. But anyway, so that's about it on that. Oh yeah, one more thing. I also highly recommend that you support your local pet stores and your local businesses in general, because everything with this whole pandemic has moved to more online and online shopping, and that it can be very difficult for all the local stores that are still providing you with excellent services. So we want to make sure that they stay around and that they don't get lost in the shuffle, because we do rely on them. So a big shout out to all of the natural healthy pet stores out there. Pages Healthy Paws, Natural. God, I'm spacing on the name. Nature's Feed. For people who are in my area, Wet Nose, Bruce and Willis. Oh, they changed the name to Hogs and Hounds, I guess. I think it was. Um, so definitely a lot of pet stores around that rely on your business, and so make sure you support them. Buy some foods from them, buy some of the supplements from them. They they need you basically. So same for Christmas that's coming up. Buy things locally so that you can support the local stores. I think they will all be very happy with you, and very very grateful basically. All right, so going back up. All right, Michelle. Well, thanks for that. Your book rocks. Love it. Thank you. I appreciate that. All right. We'll get your book life. Thank you, Beverly. That's very sweet. Yeah, thanks again for everybody who has been buying my book. It's still kind of going every month. I still see that people are buying it and giving it to other people as a gift. So thank you all for that. Thank you for the support. We, as veterinarians, I say it again and again, we can only do what we do because of you guys. And the same is true, for Rodney and Habib and Karen Becker's book. They made it to the bestseller list and New York #1 even. And I mean, they basically broke the mold with it, with how popular and how well received it's been, and sold out and all of that. So it's because of you, the community, that we veterinarians can put out that message that we have. So keep sharing it. So thank you. Thank you so much. All right. All right. I'm just looking at different things. Okay, Beverly, our burner, 11-month-old, started with itchy skin pyoderma soon after rabies shot at 7 months. Don't know if related. No issues at all before. Is there anything that can be done? I don't want steroids, and know it's where we'll be led. Yeah, steroids. I'm going to have to do a separate Facebook talk on steroids, because everybody has like a total red flag coming up with steroids. So stay tuned for that. That'll be one of my next ones, definitely. But yeah, Beverly, there's definitely a lot you can do. If you feel like it might have been from a rabies vaccine, you can certainly work with a homeopath and a holistic vet to kind of work on helping restore the immune system, because vaccines, um, and I hope that they are not going to flag my Facebook Live here, because right these days we're being flagged for mentioning that sort of thing. So I'm just gonna make a V for you know what. Anyway, so they have these things. They tend to have the potential of really derailing the immune system, that then causes a lot of itching and such. So it's not a quick fix type of thing usually, and has to be addressed from a lot of different angles, including gut health, nutrition, detox, energetically through homeopathy, and things like that. And obviously also helping them feel better in the process of dealing with it. So I highly recommend that you work with a holistic vet, and then you could also see if there's anybody, a homeopath, that can help you out with that. So you may have to do a little bit of both. But definitely, you do not want to wait. You want to get ahead of it right away, because allergies are inflammation in the body, and chronic inflammation is not something that the body likes very much. So you want to make sure that you take care of it right away, because chronic inflammation leads to all kinds of other diseases, which we definitely don't want to have that at all. Okay, now I lost my place. So anyways, I hope that was helping. Okay. Somehow Facebook is kind of messing with the order of things here. I don't like it. Let me see if that's gonna work better because it's like all of a sudden the new ones are on top and the old ones on the bottom. Yeah, okay. Oh, yeah, I totally lost my thing. That's really um okay. Well, anyways, Lisa Carbonara, do you have a video or thoughts on Palladia? My dog is 1 month post-op adrenalectomy with vena cava invasion, doing well. Palladia therapy is about to begin. I'm not an oncologist, but definitely Palladia therapy is being used for that. So it's certainly something that you can talk to your oncologist about. There are also a few oncologists that are holistically oriented as well, such as Erin Bunning. She also does consultations with veterinarians. So if you have a veterinarian, she would also consult with your vet about your dog. And then there's others as well. I can't think. Oh, Kendra Pope is another one. They could also talk to you a little bit more about that. Certainly, helping with whatever symptoms may or side effects might occur from Palladia is certainly something that you want to address once they come up. I've had a couple of dogs on it, and they did have a little bit of issues with diarrhea, chronic diarrhea, as a result of it. So sometimes we just have to kind of wait and see what happens and then deal with that. But you can certainly also work on prevention and really supporting your animal's overall system as much as possible so that it can actually tolerate Palladia well. Help the liver with detoxification and that sort of thing. All right, what else? Yeah, unfortunately, it's quite sad to see that a lot of emergency hospitals are not even able to see, to see every animal here. I know that some people are mentioning that here. Um, yeah, can you address the situation of sometimes even the ER vets are closed due to staff shortage? I'm so afraid of having an emergency situation and not being able to get in anyway. Yeah, that's a big problem. And again, that's why being on top of things is important, knowing things. And for example, if your animal eats something they shouldn't eat, try to get it out of their system right away. There are different, hydrogen peroxide can help, and just calling the ER vet as well, just to let them know. And then if you make sure you keep the wrapper or whatever it was that they ate that they shouldn't have eaten, but don't wait. Make sure that it gets out of their system right away, because if it's in, it gets absorbed, and then we can't really take it out again. Um, so make sure you get things out. You can also call poison control if you're worried about something that your pet might have gotten into. They can also tell you, how much of an emergency it is. And you can call the pet poison control directly because they actually charge for their services. So if I, as the veterinarian, were to call, they would charge me and then I would pass it on. So especially during off times, just call yourself, or even call ahead of time yourself, because that will save us some time as well so that we can get more emergencies in as a result. Yeah. Talking about the books. Yeah, it's just so heartwarming, how this message is going out. It feels like this rock has, or the snowball has is rolling, and it's getting bigger and bigger and bigger, and it's because of all of you guys. People always think, oh, it's the politicians, it's the church, or it's the whomever is going to save us all, but it's really, the community, all of us we're saving ourselves. So it's very good. Um, Deborah, I do have in the first comment of the video here, in the comment sections, I have all the links for my newsletter, website, book, etc. Yes, insurance. Lisa, I wish I had it for the thousand diagnosis and adrenalectomy. Yes, it is. It can get pretty expensive pretty quickly, unfortunately. So I do recommend insurance, especially because our animals tend to have more severe issues these days. My local pet store does not have high quality dog food. I need to shop online. Well, you might want to just talk to them and see if they can special order it for you because a lot of pet stores they can special order things. Obviously, it would depend a little bit on which one, but even just telling your pet stores what you would like, if enough people say that they would like to get more better quality foods, they will start to purchase it and supply it to their customers because they too have to make money to keep their doors open. Looking forward to the course. Yeah, me too. Hi, Kelly. Kelly has also been a very big help on some of the holistic pages and sharing her big heart. Thank you for that. Yeah, shop local and care credit is obviously another option as well when you have to, pay things ahead of time and have some credit. But they, with any credit card, if it piles up, they will charge you an arm and a leg for it. So I don't really like that part very much. That's why I don't have any debt. If I have to have a new car, I pay it off because it kind of hurts my soul to have to pay someone else, some extra money. I'm a little stingy that way. Um, all right, exactly. Pet summits. All right, I think I'm getting. All right, Lee. I have a 4-year-old Labradoodle that just started peeing when sleeping, not all the time. Vet put her on Orbax and Rimadyl thinking UTI, but couldn't get a sample. What can I do holistic to help? Chiropractic work. Obviously, you have to rule out a urinary tract infection. That's certainly for sure. But dogs in general, especially when they are spayed or neutered, they do have a higher tendency of becoming incontinent. And the nerves that innervate the bladder, they come from the spine. So if there's a little bit of immobility in the spinal area, a little bit of restriction, there may be less input into the bladder muscles and the sphincters that close up the bladder. So I recommend having your dog checked out chiropractically to see if that's the cause, because that's an easy fix and does not require any drugs. So highly recommend that. I had another thought. Oh, yes, because anytime we do any surgery within the abdomen, and sometimes even without surgery, there can be some scar tissue buildup in the abdominal cavity, which then affects how the spinal cord, the spine moves, the vertebrae move, and that can then affect, the bladder as a result. And also, when we remove the uterus from a female, for example, it can also create more space in the abdomen where then the bladder moves into a bit of a different position, which then can also make it harder for the sphincters to stay closed. So my first go-to with any dog that has any sort of incontinence is to check out if they have any sort of nerve deficiency or nerve input deficiency, which can easily be fixed. And then I usually do that in the first visit. I check it out real quick. And then I also obviously check the urine to see if there's a urinary tract infection. Generally, with urinary, if there is a potential for a urinary tract infection, I prefer going into the bladder directly, just because as a result, you actually get the urine from the bladder, because especially in younger puppies, for example, they can have vaginitis. And so if you get a free catch, you don't really know where the urine came from. Did it come from the vagina or the vulva, or did it actually come from the bladder? So when in doubt, I prefer going right into the bladder to get a catch sample that way, because if there are no bacteria in there, I obviously won't put them on any antibiotics or treat them for a UTI if they don't, because they don't have it. So anyways, moving on. Okay. Now I already forgot again in which direction I was scrolling. Oh dear. I guess maybe I need to breathe a little bit too. Um, yeah, so you guys are just talking more about the book and everything. And I think I sort of covered most of the questions here. Yeah, pet insurance. You guys are amazing for hanging in with me here. We'll be done in a minute. Just want to make sure I didn't miss anything. If I did miss anything, I will go through all the comments. I will, respond to you for sure because it's important. Oh, Sue, my 13-year-old Boston Shepherd mix came up with elevated pancreatic enzyme. She's on gabapentin and carprofen for arthritis. My vet's won her on Serenia. She eats very well, no vomiting or diarrhea. She eats Honest Kitchen grain-free. Is there anything I can do without more meds to help? Is Honest Kitchen not a good food for her condition? Well, with older animals, everything that we do has to, anything we switch or change would have to be done gently. But in general, if an animal is eating well and not having any diarrhea or vomiting or GI issues, I don't tend to be too concerned with pancreatic enzymes because the testing for pancreatic enzymes is not always all that accurate and it's not like a one, just because the pancreatic enzymes are elevated doesn't mean that there's pancreatitis. But there are certainly things that we can do to support the pancreas, including adding pancreatic enzymes to the diet to kind of help with the digestion, decreasing inflammation in general, and just feeding a low carb diet because high carb diets tend to be more inflammatory. So generally, a lot of the freeze dry, some of the freeze dried foods, although much better than kibble, of course, can be higher in carbohydrates. Personally, I like raw the best, but again, it depends on the age of the animal, how they are, and what's going on, because you know. Uh, my goal when I take care of animals is always to keep them balanced. I don't want to throw them off. So whatever I do is going to be with that in mind, depending on what else is going on. If I have a puppy that is doing really well, I may switch them over to a raw diet, cold turkey. In an older animal, I certainly would not do that. So I would go slow just to make sure we don't rock the boat. Because if we have a balance and the animal is feeling well, we want to make sure we don't fix what isn't broken. So that's kind of a little bit my approach with that. Okay, my dog is having some sort of episode, maybe seizure-like. I don't think seizure, but not falling to floor, no loss of urine. Vet thought muscle spasm, pain meds, anti-inflammatories. And that's Harry. And phenobarbital, 3 days later, still happening. Said to double the dose. I feel like we are not on the right track. What else would we look to do diagnostically? Certainly, muscle spasms, for example, can come from different things, and episodes can be different. A client of mine sent me a video recently of of her dog having episodes, and what it looked like to me was that the dog had some reflux issues, some gastroesophageal reflux issues, because it kind of kept burping a little bit and then licking and not feeling good and a bit in pain, I think. So I think just doing a further evaluation would certainly be appropriate. If there is a thought that there might be that it might be a seizure disorder, it might also be worth working with a neurologist on that and having a little bit further diagnostics done. That's certainly something to do. And then again, for me as a holistic veterinarian, I love chiropractic work. I love, and it's not necessarily the actual adjustments. I also love it because I can use it as a diagnostic tool to see what's going on. And then sometimes with doing an adjustment, I can then also rule in or rule out things, because if the animal feels a lot better afterwards, then it probably was a chiropractic issue, and some pain somewhere. So I would definitely, you know, do some further diagnostics if things aren't working the way they should. Talk to your vet, give them feedback, let them know it's not working, it's not really changing anything, so that they can also, come up with a new plan and more diagnostics. And sometimes we end up having to do further evaluation with some specialists that way. But in any case, I hope you figure out what's going on with your dog soon. Yeah, Elizabeth, my local store was thrilled to learn about what I wanted them to order and why. They happily did it, and now others are going to buy it too. That's amazing. That's very good. Yeah, the thing is, money money talks, or however you say that. I think so. Money talks. Yeah, we vote with our money. If people buy something and they don't buy something else, that something that seems to be have more value to people will stay. And we can see it. Like most stores now have some organic products, because people are, they want organic products. So that's really good. So vote with your money. Sonny, my 2.5-year-old dog, no vaccines or chemicals, had something happening yesterday at 5 o'clock in the afternoon. She did not get up from her couch, and when I picked her up, she could not lift her back end, showed no pain. I checked her. There is nothing to spot on. I gave her all night vitamin C, very increasing amounts, began to improve slowly during the night, but peed on herself earlier this morning and continued to improve until she fully recovered, with huge amounts of vitamin C and 2 magnesium capsules, one at night and one in the morning. Tonight, the chiropractor will come to understand what it was. The only thing I did different is that we went for a long walk in the morning. Do you have any insights? Well, the fact that she improved overnight, that's awesome. I wondered that the first thought, obviously, when they can't get up in the rear, is that they either have some pain or some neurologic things going on. So I'm glad that your chiropractor is coming out, and maybe all the vitamin C and the magnesium help to relax things. Magnesium tends to be more relaxant, muscle relaxant, so that might have helped. Maybe she had a little bit of spasms somewhere that impaired nerve flow, but certainly something to continue to explore. And 2.5-year-old dog. That's a bit young. I wonder what kind of breed your dog is. Because there are some breeds, especially the ones that are brachycephalic, pugs, Frenchies, these types, some Yorkies as well. They tend to have vertebrae that are not fully formed. We call them hemivertebrae, and sometimes these can get a little bit dislodged, and that can then put some pressure on the spinal cord. So in a young dog, it might also be worth doing some x-rays of the spine, just to see what you're dealing with, so that you can be more prepared as far as what to do and what not to do for her or him. I think it was a girl. Yeah, her. All right, just ordered your book. Well, thank you, Pam. That's very sweet. Thank yous. Lots of thank yous. Well, thank yous all back to you guys. Carol, do some older dogs have issues with raw food after eating raw most of their lives? My German Shepherd Lab grand dog couldn't tolerate raw when he reached 12. We tried many brands, no avail. Put him on carnivore and he's fine. Well, if an animal has been on a raw diet their whole life and all of a sudden they have a problem, obviously I would always want to check out what's going on, because there are other things that happen in life, such as drugs, heartworm preventatives, and other types of drugs, antibiotics, pesticides outside, glyphosate, which is part of Roundup, and those are all antibacterial. and antimicrobial substances that can then affect the microbiome of the gut. So if a dog starts to have issues that way, I certainly would want to do a little bit more exploration on that to see what the underlying cause is for it. But it is true that some older dogs, they just don't quite have the enough fire or enough heat to process raw food, so they may do better with lightly cooked meals. Yeah, oftentimes it's a bit of a trial and error, but I'm glad that he's doing better. But certainly, kind of checking out what's causing it would be great. Beverly, I wouldn't want to live without my chiropractor. Yes, uh, same here. All right, Marilyn, I think this is going to be the last one, and then I'm going to let you guys go, but I will answer after because it's been over an hour, and I'm sure you guys have other things to do today. All right, Marilyn, my almost 12-year-old dog had x-rays taken for a distended abdomen. It showed enlargement of the spleen. Would an ultrasound tell us more about what's going on, or if there is an underlying tumor? Yes, an ultrasound can help determine a little bit of the structure of the spleen. If the spleen is more homogeneously structured, um, it might be more benign or might not be as big of an issue. Whereas if it has a lot of cavitations, it might be more of a hemangiosarcoma type thing. So certainly something to look at. I would recommend that. All right, you guys. Again, it's been such a pleasure to be with you and spend some time here. I've missed you all. I know I've been kind of absent on Facebook. I promise I'll be around more. And again, thank you so much. And please share, because that's how we grow our community and that's how we change the world. It's by sharing and helping each other. And again, for those of you who tuned in late, the first comment has all the links that I shared about. And yeah, thank you again so much. And I will see you soon. Have a wonderful Sunday. Bye.